disasters are varied. Different disasters probably require different skills. Caring acutely for a victim of a radiation incident is going to take very different skills than caring for or some different skills than caring for a drowning victim. So the skills vary also by the type of disaster. The other challenge is that many disciplines and professions are involved. It's not unique to any one profession. And even more uniquely is those disciplines have to work together. Now, I know we think we work together many times in a healthcare facility or hospital. But I can assure you that often we do not. Often, medicine works this path, nursing works that path, respiratory works this path, and maybe we get together a little bit in talking about something, but true functional teamwork is a rarity. But that's essential in a disaster situation. It becomes essential that there are team members and that there's no hierarchy in terms of functionality of the professions. And then, of course, other thing in terms of competencies is there are many unique roles that we can play and areas of practice. So I may be very competent at teaching, and I can go in and teach first aid with the Red Cross, or I may be very competent in helping in that way. I may not be very competent in providing acute care. Maybe I'm not competent in providing psychological care that a victim needs after an event. I need to know that, and I need to recognize that, and I need to be able to refer that person to somebody who can. So the uniqueness, we're not going to have all the skills, all of them. And there are so many different roles and areas of practice. And then, because of those different roles and areas, there's different levels of performance required. As a student, if you come to help in a healthcare facility, I'm not going to expect the same level of performance out of you as I am going to expect of my nurse peer or the nursing supervisor. I still want you to do something, but I'm going to ask you to do more basic things, and I'm only going to expect a more basic level of function. And so we have different hierarchies in terms of only of function, not in terms of discipline or profession. And other problems we have hit upon already a little bit this morning is certainly the confusion and lack of standard terminology and differences. And many people lack a basic understanding of competencies and what they are and what makes you be competent. And another huge problem in my mind in terms of the competency-based education kind of movement is that we are not really yet linking competencies to outcomes. And ultimately, that's where we need to go in terms of the competencies that we say somebody should have in disaster help. Because we don't know yet. We don't know if some of those competencies actually are going to improve outcome. We want to know it. I did a review published in Pre-Hospital Disaster Medicine 2 years ago in which I reviewed all the competencies that were out there in terms of disaster health. And there were a lot of them. There are a lot of competencies. And since this has been, I did it through 2008. And since then, I can tell you, there are many more sets of competencies. So it's not that we don't have competencies that have been proffered. We probably have too many, actually. So in general, I can say there are many, numerous. Many of them are consensus-driven, but not all. Consensus meaning groups of experts got together and worked through what they believed were the competencies that should be had by healthcare people. Many of them, as Marv talked about, were eminence-driven. Someone who's had some experience said, you know what, I know best. I do. I've been there. I know best. Here's what you need. And that's eminence-driven, and many of them are based on that. None of them, as yet, have been validated. So it's a little bit of a struggle as to how we can utilize the competencies that we have. I think what we're really trying to get at, and why this is a little confusing and we don't have clear-cut answers, is the question is, what do we need to know? What do we need to know that I don't already know? What else do I need to know? I know my nursing skills. I know how to do wound care. I'm going to do wound care. I'm educated and trained to take care of wounds. Doesn't matter what the cause is. I can do that. But what else do I need to know? There must be some other skill I need to have that is unique to a disaster. And basically, because it's a competency we're talking about, it's a skill. What must we be able to do? Do I have to do something else? Do I have to do something different than I usually do? So the only way I think we're going to know this information is disaster response teams that go out and provide relief somewhere, anywhere, should never return without completing a questionnaire survey of asking, what did you need to do? What did you do? Do is the word. What did you do? What did you need to know? What did you need to do that you weren't prepared to do? What did you need to know that you didn't know? Only then will we be able to figure out what it is you need out there. And at the moment, we have some sort of anecdotal, there are a couple studies that have been done assessing responders who have returned from some deployment, some relief deployment. And certainly most of them say that they were adequately prepared in terms of their acute care skills. They weren't sent if they didn't have good acute care skills. So they were adequately prepared in that, including triage. They were able to triage patients. That was not what was threatening to them. That wasn't where they were unprepared. They were prepared there. Where most of them failed or indicated some failure was difficulty in working with a team. Difficulty in working with a team you don't know. Difficult in working with a team who may have a different language or come from a different culture, because the teams don't always necessarily work coming from the same place. So the conditions of working as a team are essential. And things that they thought needed to be stressed were the ability to be adaptable, to be flexible, to be creative. If you don't have a Foley catheter bag, what can you use to collect urine? What could you use as chest suction? How creative can you be in thinking? Once you know the basic understanding of what needs to be done, how creative can you be in that setting? So these are some of the skills, and then cultural sensitivity is one they all mentioned. They were not sufficiently prepared to work in a different culture or a different cultural setting. So I think we're starting to build a little bit of information about what we need and what we think we need in terms of knowledge and preparation. But I don't think we're really there yet. And the difficulty is that these three on the bottom are what we call pretty kind of soft issues. They're not the hard factual data information. Here's how you treat a radiation burn. A, B, C, D. I can't tell you that simply how to work with the team. That's a harder topic to teach you. It's hard. I don't know how to teach you to be creative. That's very hard. I don't know how to teach you to be real flexible and go with the flow and let things happen and be very malleable and adaptable. I can try to teach you to be somewhat culturally sensitive, but these are the hard parts that I think we still have to be focusing on and grappling with, because I think we do have the acute care skills. And I'm going to briefly talk about different words that are used with competencies. One is core competency. You'll hear that. That means all levels, all jobs and functions should be able to know how to do this. No matter where you are, no matter what your job level is, I need you to know this in a disaster setting. And then there's something else called cross-cutting, and probably refers to just about the same thing, but in this instance, it's referring to all healthcare workers. So it doesn't matter what, if you're working in a healthcare facility or in the world of healthcare, this is a competency for every single one of you. And there are a number of those. The other important thing about competencies, and here's where I think they have some real benefit, is they provide educational guidelines. I can build a curriculum on competencies. It's kind of easy that way. It's a little bit of an outline, and I can build a curriculum and teach. And also, teaching to competencies does improve the consistency of performance. And that is very good, particularly in the disaster world, when it means that a team coming from this place and a team coming from that place will probably be fairly consistent in their abilities and skills to take care of the victims. It does also create expectations among the public. If there's consistency, and this is what everybody does, they become trustworthy about the ability to have that competency. And it becomes a reasonable expectation among other disciplines and your fellow workers. And the people who are working on the team know that, yes, you're a nurse, and yes, you're a respiratory therapist, but we have the same skill level and competency level that we need to do this. And importantly, it also provides a framework for regulatory bodies. If anyone is ever going to get certified, there has to be some consistency in the competencies. So that if you're certified and you're certified, I know you should be able to be doing the same thing at the same level. And it sets standards. I'm just going to go briefly through, just to give you a quick idea. Okay, I've got 5 minutes. So this was an interesting article by Dr. Hsu from Johns Hopkins School of Public Health and Medicine, and he published something called Cross-Cutting Competencies for All. If you're in the healthcare world, no matter where you're working in it, this is what you need to know. You need to recognize a potential critical event and implement the appropriate action. You need to be observant and see if something is different from normal. And you need to know at least who to tell about it and where to go with that. You need to apply the principles of critical event management, at least in the area in which you are. You need to demonstrate critical safety principles, not only for you, but for your patients, for your victims. You need to know what's safe in that particular situation. You need to decide, do we need to get them out of here? Is that the safest thing we need to do? Understand your institutional emergency operations plan. You need to be able to know how to communicate effectively. Again, you need to know what equipment you have. You need to know how to use it. You need to understand the incident command system. What's the chain of command in your institution or your place of work? You need to know that. You need to know who you're going to report to. And you need to have the knowledge and skills to fulfill your role. And that means you need to know what your role is. And your institution and hospital usually defines your role according to your job, what your role is. You need to know it. You need to have the skills in order to carry that out. This was just an interesting little paper looking at the use of these competencies in a medical school setting.